These were not torture devices. They were trusted medicine. Children watched their bones glow inside shoe store cabinets. A brass box snapped 12 blades at once. One device truly worked, and its owners hid it for a century. One machine survived far longer than expected. The final one helped drain America's most famous man the night he died. The tooth key. The parson had been awake all night with a swollen jaw when the tooth drawer arrived at 7 in the morning. It was June of 1776 in an English village, and James Woodford wrote the whole scene into his diary. The man who came, a Mr. Reeves, was old and his eyesight was failing. He hooked the claw over the tooth, braced the tool, and turned it like a key in a lock. The extraction went badly, leaving part of the tooth behind. The 35-year-old Woodford's face stayed swollen for days, and he paid the old man half a crown. The key ruled tooth pulling for more than a century, and its logic fit the age. With no anesthesia or antibiotics, an infected tooth could kill. So one fast turn beat slow prying. The trouble was physics. That metal bar pressed into living gum like a crowbar braced against a fence board to pull a nail. The nail comes out, and the board splinters. Records disagree on the inventor. The name honors the French surgeon Garangeot, though the first clear description came from Alexander Monroe in 1742. In 1872, the physician Oliver Wendell Holmes still remembered the instrument as looking like a vulture's talon. It sold one quick turn of mercy, and it went on breaking jaws into the 20th century. The plague doctor's beak. A sick man in Pavia, Italy in 1479 met his doctor under the terms of a city contract. The doctor was Giovanni di Ventura, an immigrant with no practice of his own, who signed on that May as the town's plague physician. 30 florins a month, a furnished house, and citizenship of Pavia if he survived. The contract required him to treat every patient and enter every infected house. The famous costume came later. Around 1619, the beaked mask was credited to Charles Delorme, physician to King Louis XIII. That attribution rests on one unreliable early biography, and historians still argue how often the full costume was worn on real playgrounds. The best-known engraving of it, from 1656, was drawn as satire, not documentation. The design made sense inside the science of its day. Miasma theory held that disease was bad air itself, so a beak packed with camphor, cloves, and mint worked as a filter. The way an air freshener hanging in a car changes the smell of the exhaust without touching the exhaust. The practical part was the wooden cane, which lifted clothing off the sick, took a pulse at arm's length, and waved back desperate crowds. As for Di Ventura, the paper trail simply stops. No record says whether he lived to collect his citizenship, only that he signed. The secret in the gilded box. She was 38, her pelvis deformed by rickets, and she had been in labor for 8 days in Paris when the Englishmen arrived. On the 19th of August, 1670, the French obstetrician François Morisot handed this hardest of cases to Hugh Chamberlain, who claimed his family owned a secret that could deliver any child. Chamberlain shut himself in with her for 3 hours, then came out and admitted defeat. She died the next day, and Morisot's own account records the damage done by instruments used blind. The secret was the obstetrical forceps. 2 curved metal branches slid in one at a time, then locked together around the baby's head, like a pair of salad tongs assembled in the dark. In trained hands, the forceps could deliver living children from labors that had often ended in death. The Chamberlains guarded the tool for about a century, carrying it in a gilded chest, blindfolding mothers, and working under a sheet. They treated the design as family property and argued imitators could kill with it. Hugh failed to sell the secret in France. In 1813, the original instruments surfaced beneath the floorboards of the family's Essex manor, the medical secret that had literally gone underground. Smoke for the drowned. A woman pulled from the water in 1746 was not breathing, and her husband, on a bystander's advice, borrowed a lit clay pipe and worked the mouthpiece into her body while he blew smoke through it. A later account said she revived after the attempt. The case was retold for decades, and it fit the medicine of the age perfectly. Drowning was understood as a loss of inner warmth and vital motion, and tobacco, the wonder plant from the Americas, was counted a stimulant that could heat a body back to life. In 1774, 2 London doctors, William Hawes and Thomas Cogan, founded the society that became the Royal Humane Society, and rescue stations went up along the Thames, their smoke kits hanging by the river the way life rings hang beside a pool today. Each kit held a set of bellows, which worked like a fireplace blower, Each squeeze forced smoke down the attached tube instead of into a hearth. A doctor named Holston even wrote the method as a rhyme. Tobacco blister, breath, and bleed. Keep warm and rub till you succeed. In 1811, Benjamin Brodie's experiments showed that nicotine stops the heart rather than starting it, and within decades, the bellows were gone from the rescue kits. The society outlived its smoke. It still honors rescuers along the Thames today. The shoe store X-ray. The boy climbed onto the step of a wooden cabinet, slid his feet into the slot at the bottom, and pressed his face to the rubber eyepiece on top. His mother took one side port, the salesman the other, and on a green glowing screen were the bones of his own toes, wiggling inside the ghost of a shoe, the sole's nails showing dark around them. If you were fitted for school shoes in America in the 50s, you likely stood in one of these yourself. By the early 50s, industry estimates put about 10,000 machines in American stores. Jacob Lowe filed an early patent claim in 1919. They were sold as science, promising parents a growing foot was not being ruined by a bad fit. An X-ray tube fed a fluoroscope, a live X-ray screen, like a movie instead of a photograph. A 1949 survey found wide variation. The average machine delivered about 13 Röntgen in 20 seconds. One measured unit reached over 100, a dose no hospital would allow near a patient today. Sales staff often took the worst of it, developing serious skin damage from standing beside the beam for years, in one case costing a leg. Pennsylvania banned the cabinets first in 1957. The last one ran in Madison, West Virginia until switched off in 1981, outliving the science that once sold it as safe. Cut for the stone. Samuel Pepys was 25 when 4 men held him to a table in a relative's London bedroom in March of 1658. He had a bladder stone, often compared in later retellings to the size of a tennis ball, and no anesthesia existed anywhere on earth. Speed was the entire mercy of the craft. Patients wrecked by months of pain begged for the knife, and the only thing a good surgeon could offer was to keep the worst minute of a man's life down to a minute. Pepys survived, kept the stone in a special case, and threw a feast every year on the anniversary of his operation. 2 generations later, William Cheselden made that minute famous. His lateral approach reached the bladder like opening an access panel instead of dismantling the whole machine. Some accounts put his fastest operations at under a minute, others as short as 54 seconds, though no operating room of the era had a precise stopwatch. In 1740, he published his results from St. Thomas's Hospital. 213 operations, 20 deaths, roughly 1 patient in 10, astonishing for the time, broken down by patient age, which no surgeon had bothered to do before. Pepys spent the rest of his life celebrating the 1 minute he could never forget. The Tonsil Guillotine. The line of 11-year-olds moved 1 child at a time past the school doctor. A wooden depressor pressed each tongue, and a checkmark in a card sent another child towards surgery. In 1934, the American Child Health Association measured what those checkmarks were worth. Of 1,000 New York school children, 611 had already lost their tonsils. The remaining children went through 3 separate panels of doctors. Each panel kept recommending removal until only 65 of the original 1,000 still had their tonsils and no order for surgery. Behind the conveyor stood focal infection theory, the belief that tonsils were a nest of germs seeding disease through the rest of the body, which made removal look like a public duty. Many clinics used the guillotine-style tonsillotome, a ring with a hidden blade that worked like a cigar cutter, and afterward came the famous consolation of unlimited ice cream. The price was real. Later press accounts described children who bled to death after routine tonsillectomies, including a Canadian case in the early 1960s involving a boy named Christopher O'Kelly, though surviving records leave some details unconfirmed. The 1934 study became a textbook example of indiscriminate surgery, later cited by the pediatrician Harry Bachwin in 1945, as indications for tonsillectomy became progressively narrower. The box of wires going nowhere. The patient never entered the room. A drop of his dried blood arrived by mail on blotting paper, and the practitioner clipped it into a machine, ran wires to the forehead of a healthy volunteer, tapped the volunteer's belly, and listened for the tone to change. This was the system of Albert Abrams of San Francisco, a genuinely trained physician who announced in the early 1920s that every disease vibrated at its own frequency. Abrams claimed the system worked like tuning a radio, Each disease had its own frequency, which the machine could identify from a sample, and another device could then broadcast away. He leased the sealed boxes to roughly 3,500 practitioners under contracts that forbade opening one, like renting a car with the hood welded shut. In the radio age, when news already traveled invisibly through the air, invisible disease waves sounded like the future, and the writer Arthur Conan Doyle publicly defended the method. Then, in 1922, investigators working with the American Medical Association sent practitioners blood drawn from a rooster and still received human diagnoses back. Scientific American and other investigators opened the sealed boxes and found ordinary electrical components, a rheostat, a small motor, and wiring incapable of doing what Abrams claimed. Abrams died at 60 in 1924, a millionaire, before the collapse could fully reach him. The 12 Blades. George Washington woke in the dark on the 14th of December, 1799, barely able to breathe. He was 67. He had spent hours riding through snow and sleet 2 days earlier, and now his throat was closing. Before the doctors arrived, he asked his overseer, Albin Rollins, to open a vein. Martha begged them to wait. Washington rasped one word: more. Close to a pint went into the bowl before sunrise. 3 physicians came: James Craik, Gustavus Brown, and Elisha Dick. Benjamin Rush's influential school taught that severe illness reflected overexcited blood vessels and that treatment should deplete the body. Washington's vein was opened with the lancet. The trade's spring scarificator worked like a mousetrap, snapping 12 blades at once. He was bled 4 times, losing roughly half his blood volume. Dick, 37, argued to stop the bleeding and cut an airway instead. A tracheotomy, an opening into the windpipe below the swelling. The older men judged it untested. Around 10 that night, Washington said, "'Tis well," and his secretary Tobias Lear wrote it down. The one proposal that directly addressed the blocked airway was the one the senior doctors rejected. Did you ever stand in a shoe store x-ray or trade your tonsils for a bowl of ice cream? Tell us in the comments and subscribe for more of medicine's forgotten history.